Hi, everybody. This is Allie Orwig with the Indiana Rural Health Association. We are going to get started here in about 2 minutes to give everybody a chance to log in. Just wanted to give everyone a heads up. We will start right at 12:02. Thank you. Well, I am showing 12:02, so we'll go ahead and get started. Welcome, everybody. My name is Allie Orwig, and I am with the Indiana Rural Health Association. We are extremely pleased to have with us today Tara Hatfield and Don Gettinger of the organization Qsource, talking about culturally and linguistically appropriate services. In advance of the presentation, I want to remind everybody we are recording today's session, so if you can't attend for the full time, or if you have someone you'd like to share the presentation with, we will have that up on our YouTube channel by the end of the week. If you would like to ask any questions during the session, please feel free to use the chat or Q&A functions. You can find either of those by hovering your mouse over the screen, and depending on which view mode you're in, they'll come down from the top or the bottom. And I will keep an eye on those during today's presentation. Tara, Don, do you prefer to hold questions to the end, or would you prefer that I bring them to your attention as they come in?
We can hold till the end.
Hold till the end? Okay. So additionally, during the Q&A portion at the end, if you would like to verbally ask a question, you'll be able to raise your hand. You find that function the same place you find the chat and Q&A, but I will remind you when we get there. So without further ado, those are my reminders, and I'll go ahead and turn it over to Don and Tara.
Great. Thank you so much, Allie. And thank you to IRHA for allowing us to present this information to everybody today. My name is Tara Hatfield. I'm the Education and Outreach Coordinator here at Qsource.
And I'm Don Gettinger. I'm a Quality Improvement Advisor with Qsource.
Excellent. And as part of our Qsource's work with CMS, our team is promoting the Think Cultural Health, which is out of the Office of Minority Health. And it's an initiative dedicated to advancing health equity at every point of contact. Today, Don and I are going to be providing an overview of the CLAS standards and some examples of how you might be able to meet or improve upon these standards in your workplace. So we're going to start with the objectives today briefly, and these are simply to learn what CLAS is and why it's important. We're going to do a quick overview of the national CLAS standards. We're going to do some practice applying these CLAS standards, and then we're going to talk about resources and how you can access assistance to implement the CLAS standards in your place of employment. We're going to do a couple quick polling questions. And so polling question number 1, how comfortable are you communicating with patients from other backgrounds, cultures, religions, and ethnicities? 5, very comfortable. 4, somewhat comfortable. 3, neutral. 2, somewhat uncomfortable. Or 1, very uncomfortable. We'll give it a couple seconds for this. Okay.
Did everyone see that poll launch? Are you able to see that, attendees?
I can see it. Do we have any results?
I'm not seeing that anybody has responded yet.
Okay, no worries. We can move on. The second polling question is whether or not you have implemented CLAS within your organization, either yes or no.
There we go. We do have some responses coming in now.
Okay.
Somewhat uncomfortable
Okay,
for question number 1, and then for question number 2, evenly split, 50-50.
yes and no. Okay, very good. Well, let's just go ahead and jump in. So what is culturally and linguistically appropriate services? And really simply stated, they're just services that are respectful and responsive to each person's culture and communication needs. So CLAS can help you take into account the cultural health beliefs that may affect a person's care. They can also help you infer the preferred languages, especially for people that come into your organization where English is not their first spoken language. Can also help you look at health literacy levels, or how well individuals that come into your organization understand the information that you're providing to them, and also helps you with communication needs and client preferences. CLAS can also help make your services perceived as more respectful, regardless of the differences between your staff and the patients or clients that you're caring for. CLAS can also help make your services more understandable for the patient to be comfortable with the care that they're receiving. And can also help with the effectiveness, where you can maximize the potential for each patient to have the best possible health outcomes. And of course, we want to look at equitable care. No matter what the background, we want to make sure that the patient is receiving the best care possible. So I'll hand it to Dawn.
Thank you, Tara. I'm going to introduce a scenario. We're not going to talk about it right now, but I want you to be thinking about this scenario or a similar one in your practice while we're going through some of the CLAS standards. Because after this, we talk about that, we'll kind of discuss what standards might apply, what might be going on in this scenario. So, I'm not going to read all of it, but we have Mary, who's a 66-year-old woman walking into a clinic for the first time, goes to the appointment desk, and there's a 20-year-old receptionist that takes her appointment slip and just stares at the computer screen and loudly says her name, says, "I'll take this form and update it and bring it back. Here you go, have a pen." And instead of doing that, Mary just walks out. So think about how, cultural sensitivity can affect these things as we're working through these projects. Okay. So why CLAS? That's kind of why we're here today. Why talk about culturally and linguistically appropriate services? One, just the demographics of our population are shifting. So we're seeing more patients of different cultures, religious backgrounds in our clinics than we ever have before. There's an increased focus on from some regulatory agencies like Medicare, NCQA on health equity. Even health equity measures are starting to be included in health system rankings, like the US News and World Report, that 2022 health system rankings had health equity measures included. And so those are starting to be included in those things. It's starting to become more publicly available, and that information is getting out to the public. And then, maybe most importantly, improving the health literacy of your patients and improving the ability of your staff to be more aware of cultural sensitivities can help improve health outcomes. And Tara will talk a little bit about that at the end. Next slide, Tara. So just the CLAS standards themselves, they were developed by the Office of Minority Health in 2013, and really with the goals of advancing health equity, improving quality of care, and eliminating disparities. Next slide, Tara. And now I'll turn it back over to you actually to go through the standards.
Sure, thank you. So here, as you can see, the national CLAS standards are divided into 4 separate domains, and each domain contains standards that pertain to the title of the domain. The first one is the principal standard, and that is just one standard, and it is really the overarching standard for the whole framework. The second one is governance, leadership, and workforce. So this pertains to the people within your organization, your leadership, and your staff. Third is communication and language assistance. So this pertains to how information is relayed to your clients or to your patients. And then the fourth is continuous engagement, engagement, continuous improvement, and accountability. And this really speaks to the processes within your organization. So as I mentioned, the first domain and the first standard is the principal standard, and it really frames the essential goal of all of the remaining 14 standards that follow. Simply put, this principal standard states that care should be provided to all patients in a manner that is safe and best fits their needs. So how can you achieve this ambiguous standard? And really achieving the remainder of the 14 standards is going to help you achieve this principal standard. So moving on to the governance and leadership workforce, this domain emphasizes the importance of CLAS implementation as a systematic responsibility. It requires the endorsement and investment of leadership and the support and training of all of the individuals within the organization. So how can you successfully meet the standards under this domain? A critical element in meeting this standard is ensuring that a commitment to culturally competent care is reflected in the mission, the vision, and the values, as well as the goals of the organization. And then couple that with an actionable plan. Implementation of strategies to recruit and retain and promote at all levels of the organization a diverse leadership and workforce that also reflects the demographics and characteristics of the population that you serve. From there, you can commit to cultural competencies through system-wide approaches that are articulated through policies and procedures, as well as programs that you may have for the individuals that you serve. And then actively seek strategies to improve the knowledge and skills that are needed to address cultural competencies within your organization. Next is the communication and language assistance domain, and the standards under this domain address the understanding and application of appropriate services to include all communication needs and services. So thinking about Braille and sign language, oral interpretation of different languages, as well as written translation. You can start to address these standards by identifying patients or populations of patients or clients in your area that utilize your services, and then formalize processes for translating your materials into languages other than English that are going to better meet the needs of that population. You can also develop materials in alternative formats for individuals with communication needs, including those with sensory or developmental or cognitive impairments. And then test those materials with your target audiences. So for example, focus group discussions with members of that target population can help you identify content and material that might be embarrassing or offensive to some populations. They can also help you with cultural practices that provide more appropriate examples and assess whether some of the images or graphics that you're using, if that really reflects the population that you're trying to serve. So moving on to standards under the continuous improvement and accountability domain, these highlight the importance of individual responsibility for ensuring that CLAS is supported, while also maintaining that effective delivery of CLAS demands action across the entire organization. So looking at how we can meet these standards, I think it's important to assess both your staff's delivery of services as well as your patient's perception of those services. So one way to address your staff's delivery of CLAS would be to add CLAS-related questions to staff orientation materials when you're bringing new staff on, and then also including them in your yearly evaluations and yearly competencies. And then a couple ways that you can address your clients' or patients' perception of your CLAS services could be to provide individuals with CLAS-oriented feedback forms in self-addressed stamped envelopes to help improve the amount of feedback that you get back from that population. You could also assess the standard of care provided for various chronic disease conditions to determine whether the services are uniformly provided across the different cultural groups that you provide care to. And here's 3 more additional standards under the domain of engagement, continuous improvement, and accountability. Some ways that we could address these particular standards are to partner with community organizations to lead discussions about the services provided and progress that your organization has made to implement CLAS. This might help individuals within your area feel comfortable coming to your organization to receive care because they know that you've taken that step to meet their needs. You could also create or participate in advisory boards to consult with community partners on issues that affect diverse populations and how you can better serve and reach those populations there at your organization. And then something that I think is becoming more of a trend or becoming more of a normal practice now is engaging community-based workers or community health workers. They can help craft and deliver messages to the populations that you're trying to reach. Community health workers can help tailor messages, and they tend to be kind of that trusted messenger to those populations. So they might be good to bring in when you are creating educational programs and materials. I'll hand it back to Dawn.
Thank you, Tara. So we get back to this scenario with Mary Smith that's walking out of the office. And this is the point where it would help us if you can come off mute and talk with us a little bit, have a little discussion about this scenario. And just to refresh it, she came in and the young receptionist looks at her screen and doesn't give her eye contact, announces her name, you're Mary Smith. And then Mary walks out without doing the forms or seeing the clinic or being treated at the clinic. So we have a few questions that we'll go over, and we'll go to the next slide just to kind of get them on the screen. But the first one is, what are some of the issues reflected in this case study that you're seeing? What might have caused Mary to walk out? And Allie, I'm not sure, can the participants come off mute to speak? If not, we can put them in the chat.
Either way, they can chat, or if they want to raise their hand, if they'd like to speak, we can unmute them.
Okay. So Tara, one of them that, I'll just start us down this conversation. One thing in this, there's a young receptionist speaking to an older lady, and it doesn't really say what race or cultural background Mary is from, but the receptionist uses her first name and addresses her, by Mary, not looking her in the eyes. And so, that might be one issue, is that she's, in Mary's eyes, not being very respectful to her.
You're right, Dawn. And then also, she wasn't treated very respectfully. She wasn't greeted maybe appropriately, depending on her cultural background. She may value privacy, that she did not want her name, said so loudly, or, for the whole room to hear.
Right. Ali, are there any other chats or people raising their hands?
We've got a quiet group here today. I don't see any comments or any hands.
Sure. Another one that people have brought up when we've talked about this scenario is, it doesn't, the form may not have been in an understandable format for Mary, or it may have been complicated. So that's another thing to kind of think about on looking at that. And that kind of gets us into, maybe which of the standards would provide some guidance addressing the situation. And so when you're looking at forms, that kind of goes into the communication standards, maybe standard 8, even providing easy to understand print and multimedia materials and signage. It may be a language issue as well, so offering language assistance. Are there other standards you can think of that might address the scenario, Tara?
No, I think communication is the big one here, making sure that she was provided forms that she could read and understand and be able to fill out. And then, of course, the respect issue of respect and privacy. Perfect.
So thinking about, training, just on that, and that kind of goes back to one of the standards there, and that's just, providing some education and training around policies and practices on an ongoing basis. So providing that training during part of orientation. Okay, we can go to the next scenario. So in this scenario, we do have a little bit of more information on the cultural background. And we have Nadira Ansari, who is a middle-aged Muslim woman, and she has a post-operative visit with Dr. Smith, who's a woman, to make sure her head is correctly healing from the surgery. Dr. Smith has unexpectedly been called out of the office, though, and Nadira is now forced to visit with Dr. Kali, who is a man. And because of her religious and cultural beliefs that prohibit her from removing her hijab in front of any man who's not her husband, Dr. Kali doesn't really understand this and is culturally insensitive, and it becomes very frustrating on both sides. We can see from this situation, and there's others like this, we're just trying to give some concrete examples of how doing these, working on your class can help you address these situations or reduce the difficulty and the frustration that comes from them. So again, looking at those same types of questions, which ones are involved? What are some of the issues? We kind of talked about the hijab and the gender issue. Are there other issues that you see there, Tara?
I think, perhaps this particular organization did not take into account the population that they serve. Had they done that, they would know that there was some Muslim population there that might utilize their clinic for care, and they would be more prepared to adequately care for these individuals, especially the women of this population that have some very specific cultural and religious needs that need to be addressed when seeking care at any healthcare organization. Right.
That goes back to standard 12. Like they conduct regular assessments of your community health assets and needs, so that you can make those plans. That's great.
Yep.
Okay. So here I'm going to turn it back over to you, Tara. And like I said, we'll talk about the financial impact of CLAS.
Yeah, so as I was preparing for this presentation, I kind of looked to the literature to see what kind of financial impact, if there was any evidence-based resources or literature that kind of spoke to, the ROI of implementing cultural and linguistically appropriate services in a healthcare organization. And there was a lot of review of literatures in the literature itself. The library was kind of small, but there was one particular study that was cited a number of times by Warner and Associates. And what he found was in a setting of home nursing care that serviced a population of a lot of Hispanic individuals, an organization ended up taking the approach of hiring Hispanic nurses. They did an increase of staff education on the cultural and heritage type information around Hispanic folks, and also provided culturally appropriate patient education to the individuals that they were providing care to in their homes. And the outcomes of that was they were able to observe a hospitalization decreased by 19%, which I think is pretty good. ED utilization decreased by 2%, and then medication adherence increased by 6%, which, although is a small number, we know that medication adherence and errors is a huge factor for rehospitalization and ED visits. So I think that number we can't dismiss as small, because that could be huge depending on the error or the non-compliance of a particular medication. So I just wanted to bring out these points just to show that CLAS does make an impact on patient outcomes and financials as well.
Thank you, Tara. And I think, it's a point to make, kind of going back to our scenarios or anything else with CLAS. When we look at cultures, they're obviously not monolithic, because you look at Hispanics, and there's a wide variety of backgrounds in that Hispanic designation. You have people from different countries, and even indigenous peoples from the same country can have vastly different cultures. So it's really important to know that, and not just look at a specific culture as monolithic. Now we're going to get a little bit into the kind of what Qsource is doing around CLAS through our contract with the Centers for Medicare and Medicaid Services. What we're trying to do is provide some information and resources and technical assistance to organizations that are interested in either implementing or improving their CLAS services. And so the first resource that we're working from, and most of the information is really from here. So it's a big document, but it's called the Blueprint. And it does offer, practical information on all of the standards. And there's a chapter on each of the standards that are there. But it provides some of the purpose for the standards, some of the strategies that you can use to implement the standards, and then a whole lot of other information in the foundational concepts. It's a pretty big resource. So you may not want to read the whole thing front to back, but it is available as a reference document. And we'll move to the next slide, Tara. Some of the more practical tools that we're using is an implementation checklist for the national CLAS standards, and a practical guide to implementing the national standards. So we help you use these tools to do a self-assessment of your organization, and then work to put in an improvement plan, usually on just one or maybe two of the standards that you feel that's the biggest need for your improvement. With 15 standards, it's not something you would be working on all of them at the same time. So the work that Qsource is doing is really trying to help providers implement that action plan once you've gotten it done, the self-assessment. We can provide some training on health education or communication, beneficiary engagement to your staff or providers. And then we provide some tools like health literacy, universal precautions toolkit, other approaches like team steps or the share approach. So we're really flexible on based on what you see as a need for your organization, what standard you want to work on, what area you want to work on, what strategy to improve that standard performance. We'll kind of tailor the tools and the resources and education around that. But what we're trying to do is we're reaching out to organizations like you that are on the call, or others that are listening later. And if you're interested in partnering with us to go through these standards, do an assessment, we'd be glad to talk to you about that. The work that we're doing on this is part of our contract with the Centers for Medicare and Medicaid Services. So there's no charge for the services that we're providing, the technical assistance. We are somewhat time limited by the length of our contract, which ends in 2024. And then also, if you're a subject matter on this area and you provide training in your area, we'd be glad to partner with you so that you can share your subject matter expertise as part of those action plans for other organizations that are in your area and makes those connections. So we're always looking to partner with subject matter experts as well. Next slide here. I'm just going to share some of our references that we used for this, and it's really, most of this is on the Think Cultural Health, which is part of the Office of Minority Health's website as well. And then I think that takes us to our third polling question. So this is kind of, after hearing this presentation, how likely are you to implement some of these CLAS standards in your organization? And you should see the poll there on your screen. Okay, it's the third question on that poll. And we'll give it just a moment or two. Allie, are we seeing any responses on that?
I've got one response so far.
Just another few seconds. And actually, while we're letting you finish that up, we can also kind of move on to the questions and see if there's any questions that are in the audience.
Sure. If anybody, again, wants to ask a question, please use the chat or Q&A function to type your query. And if you would rather ask your question verbally, simply use the raise hand function and I will unmute your line.
Wonderful. All right. We did have some poll results. It looks like people are neutral or somewhat comfortable with CLAS. And can I see if I can scroll down? One of our participants has actually implemented CLAS, and one of the participants also said very likely to implement that. So if you're interested in assistance with this, we'd be glad to please reach out to us, and we'd be glad to work with you and see how we can help you. And that goes for anyone that's listening to this presentation that's recorded. Please reach out to either Tara or myself, or you can reach techassist@qsource.org, and we will get in contact with you to see how we can help. Tara, did you have anything to add?
I don't think so. We did neglect to put our emails on the last slide. So I will put those in the chat. And then, of course, Allie has them at IRHA too. If that's easier for you to reach out to her, she can certainly get a hold of us as well. But again, thank you to IRHA for allowing us to present today. It's always a pleasure to work with them. And please feel free to reach out if there's any questions or any interest. We'd love to hear from you.
Thank you both. Very informative, and I think probably new information to a lot of our members. So, or certainly information that you guys can help build on for those that have started looking into CLAS and similar programs and projects. So we'll go ahead. I haven't had any questions come in yet, so we'll go ahead and stop the recording and thank everybody for their time today.